This is also a hematology clinic, like blood clinic. So you see cancer, but you don't have cancer. Just to clarify that.
No,
So
but
it's a cancer. It's a hematological clinic as well. So
Okay.
it's essentially you refer to us because they're doing some pre-transplant workup and they found something in your blood. And we'll talk about that. It's not a cancer actually, but that's why I refer to us.
they do want to, his home nurse and his liver transplant coordinator, we just talked to them yesterday. His confusion's getting worse the last couple of days.
Which is getting worse?
His confusion.
Oh, confusion. Oh,
So they want to do blood labs while he's here, and they want me to bring him down to the ER while he's here.
oh, really?
Yes.
Oh, okay. Yeah. The bottom line is the blood condition he has is not a cancer, should not cause any problem at this moment, should not preclude him from transplant.
Okay.
Yeah. But we can talk about that. So, as far as I know, oh, by the way, this is also a teaching clinic. He sees Dr. Flynn, right?
Dr.
Yeah.
Flynn?
Yeah. So this is also a teaching clinic, so you'll meet the different levels of doctors in this clinic.
Okay.
I'm one of the fellow physicians here, and fellow physicians means I'm a physician in training for like cancer or blood practice, like subspecialty practice. I have a attending physician with me. Her name is Dr. Suzuki. So
Okay.
all communication will go through me, but Dr. Suzuki is always here.
Okay.
Yeah. And so what I know so far, he has cirrhosis, and then I think it's from either alcohol or viral infection. in the
He quit
past.
drinking about almost 5 years ago.
Okay. And go ahead.
He had one kidney removed.
One kidney, yeah, because of the kidney cancer.
Right.
Yeah. Which side? Do you remember?
I believe his right side.
Right side. Okay. And
And the left side, we're told, was only functioning at about 10%.
okay, understood.
And they didn't know if that would come back after the liver transplant or not.
They're gonna do the combined transplant, right? Liver and,
Not at the same time.
but eventually they're gonna.
Yes.
Yeah. Okay.
They said the liver and the kidneys could come as soon as a few weeks afterwards.
Okay.
But they said they don't want to do kidneys with the liver disease because,
They're gonna do the liver first and then probably kidney.
Yes, that's the plan.
Understood.
yep, Dr. Wally and Dr. Flynn.
Understood. Okay, good. And did he have a clot in the portal vein or?
They said he had a clot, but they didn't think it was serious.
Just to clarify, because did anybody tell you he had a clot in the portal vein? And
Yeah.
there seems like something chronic there.
He had a clot in his liver, right? A vein in his liver.
Yeah.
Yeah, they told us about that.
Okay. Yeah,
They
usually.
were contemplating putting him on a thinner or not for that, I think.
They talked about it, but that never, they said no.
They said it wasn't a threatening clot.
Right. They're right. It's called portal vein thrombosis. It's very common with people with cirrhosis. If it's not occlusive, usually we don't want to touch it.
Okay.
It's okay. And after liver transplant, it should be all set, should be gone. So
Okay.
yeah, it's all related to the liver.
Okay.
It's not, you don't have any like clotting disorder just because of the liver.
Okay.
Oh, good. Yeah. So good. Anything else I need to know?
His confusion's been getting worse since the 28th of September. It's been a roller coaster ride since early this year. He went for his paracentesis, which he has normally done every 9 days, and it was I think 14 days, and they took 8.8 ounces out. That night, his brother took him back to the ER because he was just way off,
Understood. Yeah.
and they sent him home again. And now Jackie, the transplant coordinator, and his home nurse, which visits, both of his doctors, Dr. Wally and Dr. Flynn, were not available today. So they said after this appointment and after blood work to take him to the ER.
Yeah, okay, understood. I'll be as quickly as possible here. So, what happened with us is during your first visit with Dr. Flynn, so she saw you have anemia and you also have a kidney impairment,
Mhm.
which we all know. But just because of transplant, they need to rule out other problems which need to be treated before the transplant. So they send a bunch of tests on you. What happened is they found an abnormal protein in your blood.
An animal protein?
Abnormal.
Abnormal protein
yeah.
in his blood.
Yeah, it is called M protein.
M protein?
Yeah, M protein. So let me show you this results.
This in your way.
No. Nope.
This here is called, I don't know whether you can see it clear, probably not, but,
Okay.
I wouldn't know what I'm
but
looking at.
there's something called abnormal protein band.
Okay.
This is what they found.
Abnormal protein band.
Yeah. Technically, it's called M protein. It's very low. It's less than 0.2. It's a very low level, very,
Okay.
very low. What does that mean? So essentially, this is something not uncommon in people in your age. This is a protein made by our B cells or plasma cells. Plasma cells or B cells, they are part of our immune system.
Okay.
They make antibodies to fight the infection. And this abnormal protein, essentially they are antibodies. But what does that mean is there's one cell, one B cell or one plasma cell. There's some mutation in it, and so it becomes abnormal. They make this protein out of control because this protein is supposed, like if you have infection, you make antibody to fight, right?
Sure.
But right now they're just making these antibodies for unclear reason. Essentially because it's out of control. There is no infection, but they are still making these antibodies. Does that mean anything? No. It's a very natural cause of our immune system. When we're getting older and older, the immune cells may make some mistakes. They may make these abnormal proteins.
Okay.
Yeah. And however, it does carries a risk of progressing into a blood cancer,
Oh.
which is called multiple myeloma. The risk is very, very low.
Okay.
It's 1% every year.
Okay.
Yeah, that's what he was just telling us.
Okay.
It's very, very low. Most people live with it without any issue.
Okay.
And what you have is we call it, let me just Google it, so probably it's better to show the diagnosis maybe. What you have is called MGUS, monoclonal gammopathy of undeterminate significance.
Monoclonal
Monoclonal
gammopathy.
gammopathy of unknown,
Unknown
significance. Yeah.
MGUS.
As you can see, unknown significance.
Okay.
So, essentially, this is a benign condition. The disease itself, I would not say even disease, the condition itself is a benign.
Okay.
Don't need any treatment.
Okay.
What we need to do is just check your abnormal protein level every year, make sure they remains low.
Okay.
That's it.
Okay.
And this should not preclude you from transplant.
Okay.
You should still get your transplant.
Okay.
I think they just want a clearance from us that you're fine for the transplant with this abnormal protein. The
Okay.
answer is yes, you can go for transplant.
Okay.
Yeah. Questions?
Well, thank you. No.
No,
Question?
No, I mean, I just wanted liver transplant.
Yeah, I know. That's why I want to clear you for liver transplant.
Yeah.
Yeah, that's what this appointment for, because your appointment with Dr. Winnicker is too late. I just want to clear you as soon as possible,
Yeah.
because you missed the appointment with Dr. Winnicker while you're in the hospital. Right?
No. I didn't know that.
That they scheduled a hematologic appointment while he was in, unfortunately he was admitted in the hospital. He missed that appointment. They have to reschedule that, but with the same provider, Dr. Winnicker. The next appointment is in next year or November. I
Oh,
believe.
okay.
Yeah, that's why I moved up with one of the fellows here. That's me.
Oh, okay.
So that's how we can clear you earlier, so you can go for a transplant.
Okay.
It's not gonna.
Now his mouse score, if I'm saying it right, the 0 to 40 scale, that has been too low now.
Okay. Yeah, that's probably you know much better than I do.
Okay, that's
About this
okay,
mouse
sorry.
call. I haven't touched the mouse call for many years.
Okay.
Yeah. So I don't know your status of transplant right now, but we just want to clear it as soon as possible
Okay.
from our perspective.
Okay.
That's what we want to do.
Okay,
Yeah.
thank you.
Yeah. So, because I saw you have multiple hospitalization because of this, we call it encephalopathy, confusion.
Mhm.
This is all liver related.
Mhm.
And you got this paracentesis and rhinitis. That actually increase the risk of confusion as well. Yeah, so.
Usually the day he has it, or the days he's a little worse.
Yeah, so, yeah. Can I examine you quickly?
Sure.
He also has a bandage on his stomach from the paracentesis
I'm not gonna
bandage.
touch that. I'm
Okay.
not gonna touch that, yeah.
Okay,
That's all right if you did, it doesn't hurt.
So,
You want me to stand up?
no, just sit there. Do you know where we are? So I have to ask
Oh,
you
yeah.
something. Yeah, go ahead.
Yep, UMass Medical.
Good. What's the date today?
Today is,
Or what's the date today?
Today?
Yeah, Monday, Tuesday, Wednesday.
today is, I don't know what day of the week it is. I don't know. I
It's
don't know
okay.
what
Today's
day it is.
Wednesday.
Okay, I believe you.
Do you have any family history of any type of cancer?
yes,
Yeah.
yes.
What type of
Oh.
cancer?
His father died of cancer on
What
his,
type of cancer?
on his
Oh,
kidney.
yeah.
Kidney cancer. Do you know whether it's the same kidney cancer or different one?
I believe it was different.
Different one. Okay. No swelling.
No swelling today.
I assume he's on lactulose.
He is, and he's been having a lot of accidents lately.
Okay. How many times a day?
He had 2 accidents yesterday, one in the morning and one last night.
Okay. What's the goal right now? Like 3 or 4 times a day?
He's actually having it 4 times a day right now, Steve?
What?
The lactulose, is it 4 or 5 times a day?
Yeah, I'm having it like 4 times a day.
Oh, okay.
Every 3-4 hours.
I think I'm having it too much, but I mean, that's just my choice.
They said you can adjust it, and then his confusion got worse. They stepped it up a little bit,
Yeah.
but now the diarrhea's getting so often,
Understood.
we don't know, it's a fine line.
So it's this is a annoying part of managing of this confusion because they usually wants you to be a little bit like on diarrhea all the time, so
Yeah.
you'll be more clear. Unfortunately, that's the treatment for this confusion without transplant.
Mm.
Yeah. Let's see. So what I'm gonna do here is you're just gonna see us a year. That should be enough. We don't need to ask very frequently. If you have to cancel the appointment, it's fine. Just reschedule, but every year should be enough. with us.
Okay.
And every time when you're here, we can collect on labs. The labs what we need for your abnormal protein.
Okay. Do you need to make that order?
I'm gonna place order today for next year.
Oh, okay. How do
We got all the lab while you're in the hospital, so we're all good right now.
how do we go about getting the lab test done today? Like his visiting nurse wants and his,
Did they order the labs?
no, but they said have them done while we're here.
What lab do they need to know? Is
I don't know. He has blood work.
oh, doctor. Yeah, they ordered some labs today. Yeah,
Jackie.
that's completely fine. What you need to do is, I will let lab know because lab is on the same floor here.
Okay.
You just check out from here, and then they will ask. They'll probably ask you coming for the lab like within 10 minutes because they have to get some prep
Yeah.
first.
Okay.
Yeah, you can get it done here. It's fine.
Okay.
I saw some lab order from Dr. Flynn.
Dr. Flynn did put a lab order in.
Yeah,
Okay.
yeah, from yesterday.
From yesterday. Okay,
Dr.
perfect.
Yes.
Jackie
Yep.
was,
Jackie's your coordinator.
Yeah, from yesterday. Yeah, sure. Let me talk to Dr. Suzuki quickly, and then I'll just let you collect the lab and go to the ER.
Okay.
okay.
I thank you.
No problem.